Oh, Ahan is teaching as well. Ahan is in Australia, living in Melbourne. It's, people's dream, one of the most livable cities. He's a dentist. So when people hear about this, they'll be like, oh, amazing. But 7 days a week, doing 12-hour shifts, and then doing a master's, and then doing ADC.
Whatever we post on our social media after passing, that is just the tip of the iceberg. Once you accept that, okay, it's not just about me, it's maybe somebody else was better that day, that helps a lot.
I had that moment where I felt like I was doing a door-to-door job as well. They have made that very specific criteria. It's not as easy, and that's why I feel like, as you said, I totally agree. Was there a moment that you felt like, oh, this is not gonna happen?
But it's okay. I'll make my peace with it. And I was like, okay, that gave me the strength to.
At that point, what kept you motivated? What was your motivation force?
What's that quote? If it doesn't kill you, it only makes you stronger. And that helped. Like, see, like I'm here right now. That's amazing. Try to surround yourself with the right kind of people.
Yeah.
Absolutely. If you were about to drop it, this is the spark that you needed. This conversation, just use it, ignite a big stick of matches, and then start your ADC journey. Burn that flame.
Hi everyone, Dr. Mak with another video, and I've got an exciting video today because I've got Ahan with me. And I've always seen with this ADC journey, it's always, the journey we go through coming from overseas and, starting our journey in Australia. It's not easy. People think it's easy sometimes, or people think, it's going to be very, very difficult. It's very drastic on both sides. It's not as it is. The most important thing of doing this kind of like session with people who have done this journey like myself and Ahan is also making people realize that sometimes there's a lot of effort done in the background. What you see today, someone doing, or the work someone's producing, or where someone are at their life, or what their achievements are, people feel, oh my god, I love that. But there's like 10 years in the background, or 5 years in the background they've done. So I wanted to introduce Ahan
Thank you so much.
to the podcast today. And we're just talking about the life after doing ADC and about ADC and the whole journey. So I'll just ask Ahan, if you introduce yourself to the audience.
For sure. Thank you so much, first of all, Dr. Mak, for inviting me for this podcast.
It's a pleasure.
We both actually go couple of years back. Basically, when I started my journey, I saw you posting on Instagram your reels about helping ADC candidates and stuff like that, and I sent you a long text message saying how I would love to have you as a mentor in my journey. And then I ended up taking up your course.
I remember that.
I did a technical course with you, and then failed once, did some more refinement with my technical tasks, and a couple of feedback sessions with you, and then eventually it was November of 2022 when I passed the exams. And ever since then, I've also started to give back to, like, learn from you. You started your journey, then you started teaching the candidates. So when I finished it, I also felt like, okay, there is a need to, because there's, like you said, there's a lot of candidates who don't know. Some might think it's too easy, some might think it's too hard. But it's, you played a role in my life. I'm trying to play that role in other candidates' life. Like, it's to guide them, to mold their journey into a way that it's not, they're not overwhelmed with the entire process.
And see, it's all about, at the end of the day, it's all about giving back.
Absolutely.
Especially when we were there, the people who helped us out, and we know how hard it is, how difficult it is. That feel like once you pass, you genuinely want to do something. And I feel like that's what I really like about you as well, that you already helping people, guiding them on, the pathway of becoming an Australian dentist. And as you said, you got it from me, but you are actually doing that, playing that, the bridge role now and doing that. So Ahan, tell me a bit about yourself to the audience. Like, when did you graduate? Where you originally from? How did you think about coming to Australia, and how did that the whole journey started?
Definitely. So basically I graduated my BDS, which is Bachelor's in Dental Surgery, back home in India from a state called Gujarat. It's in the western part of India. I graduated in 2019. After graduating, there was a couple of options. One was to stay in India, but as we know, like in our part of the world, with India, Nepal, Bangladesh, Pakistan, you don't get enough like salary or money for the stuff, for the studies that we've done over the 5, 6, 7, 8, whatever years,
Yeah.
So there was a plan that no, it's I have to go outside to build that life that I've always wanted. I'm into cars, I'm into watches in a way, so like every boy is. So I'm like, okay, I want that. I want a luxury to provide to my family as well. It's not just that, but to my family as well. So I was like, I have to move outside where there's better reward for the struggle and for the effort that we've put in. So it started there. Researched about USA, UK, Australia, Canada. Out of all of them, Australia seemed to be the easiest and the straightforward. USA needs more studies. UK, there's issues with immigration in the future. Same with Canada. So landed up with Australia like that.
So did someone, like, at that point, was someone already in Australia? Like, how did you find, or did you feel like Australia was a better option?
It was just by my own research, I found it was a better. Everybody in my batch went to US. Everybody that I know. But I was like, nah, I can't put that pressure of another $200,000 loan on my parents, because that is required in USA. You have to do extra 2 years of studies and all. So I was like, nah, I can't do that on my family. That big burden. So I was like, what's the best way to get our degrees recognized? In Australia seemed to be straightforward, because you just have to take the exam. At least on paper, it's just a theory exam, practical exam. You pass that, you are a registered practitioner here.
Yeah.
So it looked very straightforward back then. Of course, it was very naive, because it is more than that.
Yeah.
But that was my thinking. I had a professor in my oral surgery department who I used to sit with every day, and he used to guide me. Like, okay, now if you want to do Australia, then see what's the roadmap. Like, where do you want to start with?
Yeah.
Initial assessment. What does it require? What course will you need to take and stuff like that. It started with there. And then after some research, I got to know, okay, you need to come on student visa. That's the only way that we can come here.
Yeah.
So came here on student visa, did my master's in public health from Deakin University, came right in before COVID hit in 2020. So did my 2 years of master's in public health while COVID was going on in Melbourne. And then with that course, I did my theory exam, part 1, passed that, and then started taking, again, different coaching classes like yours and others to practice for part 2. And eventually in 2022, like I said, I finished the ADC journey. And then since then, I've been practicing.
So, Ahan, one thing, like, which I ask everyone, I meet so many dentists around the world, and my first question is about how easy was it?
The ADC journey?
Yeah.
Well,
or how easy, like, how when people see it and they'll be like, oh, this is like, and I'll be honest, I was, how you felt we all are knife. I was like that. Like, initially when I came to Australia, I was like, I came on my master's and I was like, I'll finish my ADC within 6 months. I'll quit my master's and then I'll save my money. And then you realize it's not as easy as it looks.
So to answer your question, same. So whatever we post on our social media after passing, that is just the tip of the iceberg. That's what I try to tell everybody.
Yeah.
That all the success stories of all our patient consults or whatever, before and after photos and stuff like that, that is just a tip of the iceberg. What we did to reach there has been crazy. So just to give an idea, like, for example, the exam itself, it's all out on the social media and on the ADC's website as well. The passing rate for the theory exam is about sometimes 25 to 30%. For the practical exam, it's even less. It's about 15%.
Sometimes even less.
Even less than that.
11%, 12%. There are.
And then in some, like just recently, couple of my colleagues took the exam. Out of 24 people, nobody passed. So it's even like that. Out of there was 0% in that session. So that is there. That is the biggest hurdle, which I didn't know. Nobody knows how tough it is. On numbers. That's just very objective.
And that's what I try to explain it to my students as well, that, when I'm talking to candidates and stuff, that sometimes it's not about if you perform bad. They have a number, They can't, like for example, when people do DDS or when we did BDS, out of 100 people or 50 people in the class, all the 50 passed, right?
Yeah.
If when you do DDS or when you do another like dental,
you're gonna pass.
like I'm doing currently my masters, I know maybe one or two people might get a supply, or they might fail in one subject, but they still end up passing.
You know that at the end of the day you are gonna pass it.
But when it comes to ADC, one thing everyone needs to understand is it's not necessary that you're gonna pass.
Not at all.
And that's where it comes, is that they have made that very specific criteria that if 25 people sitting in the exam, no one actually qualifies the criteria, they will pass. No one.
That's simple.
It's not like they have to pass someone. It's not like that. And sometimes I always tell people that it's not about you performed bad, it's also about maybe someone performed a bit better than you.
100%.
Like you would hear your friends and candidates blaming that sometimes, oh, I did so well. And I'm sure they did. They all are dentists,
there was someone else who did better that day.
Yeah.
So that's there as well.
Yeah.
But so on numbers, yes, it is very hard. But then on the preparation part, it's even harder because, like you said, we have never failed in our BDS. It's like you always pass. But ADC teaches you to be humble. Like you have to just take it in that you will fail. You have to accept that fact. Be humble about your learnings. And as long as you are humble about, like, you might fall, but you just pick yourself up, go a bit ahead, maybe learn a bit more from that failure, but keep going at it. That's what I learned, because I also failed once, so I knew it was hard, because we've never, as dentists, we've never failed in our first year, second year, any year, It was very hard to take that. But once you take that, once you accept that, okay, it's not just about me, it's maybe somebody else was better that day, that helps a lot.
And I always tell everyone at the same time is, if I can pass, Ahan can pass, you all can pass as well. So
100%.
It's not about, demotivating someone that ADC is difficult and you can pass. It's never saying that you cannot pass, but at the same time, also understanding the fact that what you see in someone's life, they have not given it that easily. They have worked really hard for it. Like just Ahan's example, he was doing masters, but he was doing ADC at the same time. I'm sure he was working as well.
I was working seven night shifts. So every night I was working a night shift at an aged care facility, and 4 days, 12-hour shifts. So I had only 3 days to prep for the ADC and my masters. So that's the struggle part, which nobody actually knows that much,
Because people must see you now and they'll be like, oh, Ahan is teaching as well. Ahan is in Australia, living in Melbourne. It's, people's dream, one of the most livable cities. He's a dentist. So when people hear about this, they'll be like, oh, amazing. But as Ahan just explained, 7 days a week, doing 12-hour shifts, and then doing a master's, and then doing ADC, and then still managing. It's not as easy. And that's why I feel like, as you said, I totally agree. Passing ADC and doing the journey actually makes you more humble. You start to respect people a lot differently.
100%.
Who are doing the journey, even other people as well, I think that's kind of like...
Sure. Like it teaches you a lot about life in general. Of course, ADC, you will become a dentist at the end of the journey, but you will become a different human being after passing the exams. So you just have to go be at it and keep learning. Like, there's so many courses, like, mentors, and everybody approach them like I did to you. Like just start texting people who have passed, or who are teaching, or whatever that they're providing. Get as much information as you can. And that's what I tell every candidate that I meet up. Like, just take it all in, and then have a game plan, have a plan to follow. And eventually, like you said, if I pass, I tell that to everyone. I was not the best student in my BDS years, not the best student work study wise, So if I can pass, anybody can pass.
And see, I always tell everyone as well, like, when I share my before and afters, like I teach my resin and aesthetic dentistry now as well, and people see my cases. And when people talk about Lionel Messi and all those superstars, I'm just giving an example, like Roger Federer, and they be like, they're God gifted. No one is God gifted. They have done, like I've done like thousands and thousands of teeth, and now I can do a composite that people think it's, it's like God gifted, but it's a lot of work. And that's the same thing as you were saying as well, that initially It's so much work to the point you reach there.
Yes.
Ahan, like, was there a moment, and I know I had a moment, but was there a moment where you felt like, oh, this is not gonna happen? You were really drained out and really, stressed out to the point that you were like, am I doing the right thing?
Thinking about that moment already. I had that moment.
Because it's very personal. If you don't want to share it, that's okay. But like, I had that moment where I felt like I was doing a door-to-door job as well. ADC was very difficult. It was out of the skilled occupation list where people were like, you might not even get permanent residency. And we're like, am I doing the right? Did something hit you at that point?
Absolutely. So what happened to me was, up until I took my theory exams and I attempted my first practical exam attempt, all was fun. I was very confident. But that moment, like I said, no, when I got that failed result on that day, I remember I was working at my aged care facility where I was working. We had some COVID cases there, so I was all in PPE kit and all of this, helping residents and all. I had my lunch break for half an hour. I saw my result. I saw fail. Okay, and I didn't have time really to process that. I just called my parents. I was like, I was gonna go to India in the same year, end of the year. I called my parents. I was like, I'm not coming to India. I wanna pass these exams. Only then I'll come to India. I don't wanna come to India. And on that day, for the first time ever, that was 3 years into coming to Australia after moving from India. It was the first time I cried in front of my parents on the phone. And I could, like, that day, all of my emotions just came out because I was like, am I doing this right? Like, what am I doing at this facility working as an agent for like a personal care assistant? I had no, like, I didn't see if there was any future ahead of me or not, whether I was taking a right decision in all of this journey or not.
Yeah.
And that moment was where it was like, oh my God, I was the lowest I've ever been.
And like I'm sure you talk to so many candidates now because part of the journey of guiding them coming to Australia as well. I've talked to so many students or candidates who have like 15 years experience in the background. They're married, they have kids, there's so much happening in their life. And to the point that some people actually, go through a divorce phase. Some have neglected their children for 6-7 years because the ADC is not passing. So much, and that's why I tell everyone that it's not just an exam, it's a whole life event.
It's a life event.
And it could be very traumatic, or it could bring a lot of anxiety or trauma in your life when things are not happening. A lot of people like us, like we were alone. We didn't have a partner at that time, no wife, no kids. So sometimes even that being isolated and by yourself can hit you strongly. And I'm sure a lot of people listening could connect there as well. So there's so many, and that's where we say that, it's that journey where you just have to keep going, and it might not be the most easiest out there. So at that point, what kept you motivated? What was your motivation force?
At that point was like, I almost had this mental exercise also. I was like, what's the worst case scenario?
Yeah.
What is the worst case scenario that can happen? Okay, there's no, if I fail the exam after multiple attempts.
Yeah.
If I don't get PR, for example, even after passing themselves.
Yeah.
So I was like, okay, the worst case scenario is I have to move back. I was like, okay, if I'm moving back to my friends and family, people I love and care about, it's not worst case scenario at the end of the day. It's not the end of the world. And I made my peace with that worst case scenario. I was like, okay, if this is the worst, but it's okay. I'll make my peace with it. And I was like, okay, that gave me the strength to do, like, once I made peace with what can happen, I was like, okay, that's fine. If I can make peace with the worst, if it happens, that's moving back to our home country.
Yeah.
I'm like, that's fine. I will weather through everything. And then the other thing was, like, I'm healthy. My parents are healthy. My friends and family, everybody is healthy.
Yeah.
Of course, it was a hard job.
Yeah.
But I was making money enough to pay for the ADC exams, pay for all the courses, and everything that takes. I have all of that. Like you said, there are people who go through divorce, who go through so much more through this journey.
Yeah.
And I was like, I'm not going through any of that.
Yeah.
I only have to put my work at the end of the day, right? Yeah. I can do that. I'm like, that's not bad. I'll go at it. As long as nothing. What's that quote? If it doesn't kill you, it only makes you stronger. So That's what I believed in.
I can't agree more. And I'll be honest, like I keep telling everyone, I've said this in so many of my multiple videos as well, that you just keep trying.
Exactly.
I don't know if you're going to do it in the first attempt or in the 10th attempt. I don't know. I actually know someone who's passed it in the 9th attempt because their part 1 expired 3 times. Right? But they did pass.
Resilience.
But sometimes that's why I'd say that, there's no guaranteed anywhere that you can pass it in the second attempt. Yes, some people pass in the first attempt.
Yes.
Good on them. It's amazing. But it's difficult. And that's where I say is have a realistic expectations. It's also important that I've seen is sometimes everyone has their own, different struggles, right? Some people could have a bit of a different kind of struggle, but they have their support in a way that, a lot of, for example, people come on a marriage visa. But they could work, but they don't have a pressure that they have to study and pay money. They could focus more on ADC. They have a bit more support.
A lot of candidates are like that. Believe it or not.
Yes, and that's what I feel like. So sometimes when you see someone who passed in the first attempt, maybe they're different circumstances.
100%.
Maybe, and it's not taking the credit away. Maybe they have actually worked really hard.
Yes.
But I've also seen is, like when we say I passed ADC in 2 years, that's where we miss out. And what you think about it, tell me as well, Ahan, because what I've seen is when I've actually gone into the depth of it, I've seen that people who say I've passed it in 2 years, you actually see the background work they've done overseas. They might have given 10 years already.
Yes.
So now they're doing it quicker.
Yes.
But someone came here and they did not do a lot of background work. They may be taking longer. This also. But then there's certain times where people are really experienced and then they're still not passing.
Yes.
I've also seen that it's a mindset thing, one.
100%.
And second thing, like there was a boxing movie of Farhan Akhtar, Tufan, right?
Yes.
And after that, I was like, I want to get into boxing and everything. Last time when I saw his Bhag Milka Bhag movie, I got into fitness. I was like, I'll get into So I started taking some personal one-on-one coaching. And the guy told me, have you ever done boxing before? And, I said no. And I thought, but he's like, that's a great thing. Because whatever I'm going to teach you, you're going to start from zero with the right technique. I feel like what I have noticed, because now I've been training even specialists like prosthodontists and all this thing, doing crown prep, I feel like they have developed those bad habits for 15 years or 12 years. To unlearn it, it's a lot about giving away your ego. And I'm sorry I'm using that word, but I feel like sometimes if I'm doing so much cosmetic dentistry and after 10 years someone tells me that, you changed that, I might not be able to do it. I'll be like, what are this guy? But that's what I tell everyone. It's a theoretical based practical exam. Sometimes it's not about how good you are. This is what the exam wants. And this is, I think, part of my teaching, or I'm sure it was all about, this is a pass and fail.
Correct.
You can be really amazing at it, but this is how you're going to pass.
I know what you used to say and you keep saying as well. You do not have to, your crown prep doesn't have to look beautiful. You just need your basic, the rubric correct. That's it. Do not make your Instagram worthy crown prep. So that's the thing, right?
And most of the Instagram worthy were not passed, remember?
Yes, 100%.
They were under.
Pass. Yes. So
there's the social media trap thing and everything.
Absolutely.
So I feel like there's so many things that people feel. I feel it's good to find something that motivates them as well. So it's great that you had that positive mindset.
Yes.
I feel like it's good if you have a family support. But there are points which you will go down. There are points you will lose. I know so many candidates, they give up on ADC.
Yeah, a lot.
And then, but one thing I must say is, if you are happy with giving up and you have something else and you're happy, it's completely okay as well. There's nothing wrong that if you didn't become a dentist in Australia, it's okay as well. But also to the point that if it bothers you too much, if you have given up in the middle, you can come back.
Absolutely. It's as easy. Just come back, you do it again. As long as you have that in you, keep doing it. And to add on to your point earlier that you said, how candidates have to unlearn first, and then, that's very important. When I did my journey, because I was just fresh out of uni and came here, I had zero experience. Like my slate was clear, so to speak, right? So whatever I learned was here only, be it technical task or the communication, because I personally feel the communications is where most of the dentists, overseas dentists lack, and they
Struggle.
fail.
Yeah.
Technicals, even like I say to a lot of, if you give a donkey like 6 months, they will do a crown in 6 months. But communication is something that
Yeah.
if you've worked in for 10, 15, 20 years in another country, there's a lot to unlearn and then to learn again to pass. So
And
that is very
communication again,
Yeah.
Ahan, coming back to your same
Yeah.
point, and that's why we want to start
Yes.
that soon as well. But with communication, it's not about how much knowledge you have, it's about what you say.
Correct. You have to be present, very present in the moment, and what you say in that moment, how you portray that information to the examiner or the patient.
Because what I've seen with technical is one person who have practiced so much. They've done like 2,000 crowns. They're still failing because they don't understand the criteria, or they don't want to understand what the exam's saying. If a mentor is telling them, sometimes they feel like, oh, what is this guy telling me?
The ego part comes in.
And I feel like, but that's where they suffer themselves.
Yeah.
Because I feel like sometimes it's so important in our professional world, no matter how good you are. You see some of the best surgeons in the world, they're open to learn still.
Growth mindset, go down and just learn.
And someone's telling you something, you should listen. It's basically going to help you. No one's taking your, your like all that fame away. No one can. Second thing, what I've seen is it's practice, but at the right way as well. If you do wrong practice for 20 years, you're not doing anything. So right way of practicing does help as well.
Yes, you need that, and that's where a mentor or guide, a person helps, because you are willing to do the practice. If you're not doing the right practice, you're gonna fail.
But also I feel, Ahan, that find anyone that you genuinely believe in and you trust. Because the problem, like when you join my course, you genuinely believe that Dr. Mak is saying his son, and you believe, and that's what happens with 90% of the students. When they come on board, they'll be like, I genuinely believe in you, I would follow that. But the 10% who don't, that's where again, do you think the same way?
Absolutely. That's the thing, like those 90% of the people who follow, those are the ones at the end of the, I think, will pass the exams, because you have to believe in what you are being taught and what you're doing as well. If you don't believe in what other person is saying or doing, you're not gonna inculcate and you're not gonna pass the exam.
What is your tip for people who are maybe in the middle of their journey?
Right.
They are struggling, they have lost their motivation. What is your tip for them to get motivation again? Anything that you can suggest?
Well, a smooth sea never made a skilled sailor. So if everything was smooth, you wouldn't be the person that you're gonna be in future. Like, imagine your future self, who is an amazing dentist, amazing person, who nothing can tear you down. Nothing in life can tear you down. You have your character. ADC teaches you to be that. So if you are confident that okay, you want to reach that stage, just go through this. This is just a difficult path in your journey. And like I said, if you make peace with the worst case scenario, if you're okay with that, nothing can stop you. Nothing at all can stop you. Just keep at it. And surround yourself with the kind of people that you want to grow. Don't be with negative mindset people. Like I erase those kind of candidates, ADC candidates who are like, no, I don't think I'm gonna pass. No, I don't think you'll pass. It's so hard. I failed twice. You're not gonna pass it in one attempt. Erase them out. Be with people who are like, oh, I failed for 3 times. I'm gonna go again. Like you surround yourself with those kind of people who are also motivated. That helps you. Everybody grows together.
I can't agree. Like this statement. I have always been like when I do my teaching as well. A lot of thing is more related to that positive mindset.
Absolutely.
And motivation as well. That drives you. I used to meet people when I was doing my ADC. They said it's impossible to pass.
So many people, right?
Some said no. I've done my daughter or someone I know has done 5 times. How can you pass? And they'll be like, even if you pass, you won't get permanent residency. Why are you? And I was always thinking, After I pass, then I can look into the permanent residency.
Exactly, it's not.
And I'm
current
sure,
problem,
I'm
right?
sure there was a way, and
Yes.
I got a way, and I
did it,
got it
right?
done, right? So I always feel like the problem is we always already like I feel like the good of YouTube, and I really wanted to start this is because when I came and I searched, there was not much help. And at that time, Dr. Muhammad Suleiman, his YouTube
Yes,
channel
I've
was
heard-
amazing.
Yes.
And I felt like it's so amazing that the word should be there. And that's what kind of like motivated me. And I promised myself when I passed, I will make sure I at least put 100 videos. So even if I'm not alive at that time, it could keep the word going.
True.
So I felt like it's that mindset is so important. You have to believe in it. Otherwise, it's just like, you go in and people are keep telling you it's not going to happen, not going to happen. Because I believe, because I feel if you hear that negative comment 6 times, it will not happen.
Not happen. And then you self-doubt yourself, you go into a spiral that, oh, I'm not good enough, I'm not worthy enough, and all of that. And people will try to pull you down. There are people. So you just avoid them. Just avoid them. Back in uni as well, I remember, like, I am first student from my university who passed the exam, ADC exam. Everybody back then was like, oh no, nobody has passed, people
Yeah.
don't pass, and everybody who's listening and watching as well must have come through those kind of people who will
Yeah.
just demotivate you.
Yeah.
So you just have to erase them. That's my tip number 1.
I still remember at that time when I was doing it, I connected with Dr. Bedo.
Yes.
He's my mentor. I still message him a lot. I'm highly grateful to him. I always talk very highly of him in more videos because I felt like I connected with him. I did his course and I genuinely believed in him. I feel like his teaching, a lot of people were like, oh, this is, and I was like, no, this is, Dr. Bedo has told me this.
Right.
I want to follow this because I genuinely believe, and I felt like it made a lot of difference to who I am. And that's what I've seen in you as well, that when you're learning, and that's why I say to everyone that if you don't, for example, any mentor you find, if you don't connect with them, find a different one. You don't have to hit your head and saying, because and it's normal.
It is.
I think no mentor take it personally if you say that, oh, I don't like your teaching. That's fine.
Everybody is different. Your values and views might align with somebody else. So you just have to be out on the lookout. And now with social media, it's so easy. You can always go around and you can see how a person is and make that judgment. There's everybody's work is out there, everybody's personality is out there. So you get an idea. Like when I saw you initially, I knew, okay.
Where did you see me first?
I think I saw one of your YouTube videos.
Okay.
Initially, this is 3 years ago. I don't know exactly which one. I saw one of the motivational YouTube videos, I think.
Okay.
And I'm also into a lot of growth mindset. I'll watch a lot of podcasts and I'm into a lot of like motivation basically just to in general. So I was like, okay, no, I could see that in you as well as a personality, that what you are as a person. Dentistry aside, that is going to be there. Like you said, every mentor is a good dentist. Every candidate is a good dentist. So dentistry, everybody will be teaching me, any mentor. But how that person is, the mindset and the mentality, how it aligns with me, that mattered to me a lot. And that's how that's why I wrote a big text to you, because it hit me in that moment. Yeah, I connect with you. And that helped. Like, see, like I'm here right now. That's amazing.
Now that is, and to be honest, like I did not realize this. I still remember when my exam came, I called Dr. Bedo and he was crying.
Oh.
He was so emotional for me, and I could see it. And I was like, oh my God. And he's like, the day you teach someone and you highly feel, because there's some students or some candidates, you genuinely want them. And Dr. Bedo told me the same thing. I was like, you may be a good dentist, but you're a genuine human being. That's why I want you to pass. And I was like, he was open about it, and that's fine. But that's what I felt like. He was. So when someone who you genuinely feel who they pass, and when my first candidate, I still remember, now it's been like over 300 plus, but first candidate who passed actually did hit me. You could feel. And now when some people, like, again, I don't want to take name here. There's one candidate, 8 months back now, he did ADC for almost 8 years. He messaged me. I did like a YouTube live one day, and then I think it was only not a lot of viewers. I think 200 plus views is but he kind of like connected. He messaged me, he's like, I'm driving a bus now. Like, I'm a bus driver from the past 5 years, and it's an amazing work, everything.
Yeah.
But he's like, I've been doing it for 8 years. I still wish, and it's my last attempt again because my ADC is gonna expire again in like 8 months.
Yeah.
And he's like, I still wish that it's not about this. I'll always regret. I wish I would have done it. And he was like, I think he was 48, because he's done a lot in his life and everything. And again, I don't want to share too much details because otherwise people know who I'm talking about. But he messaged and I was like, okay, I would, I can help you from my side as much as. And it was more, he's already knowledgeable. He's 15 years experience overseas. He has already done so much. It's not like he doesn't know dentistry, as you said.
Yeah.
Everyone is a dentist, so you're not competing with a chef. You're competing with everyone knows. But that motivational mindset, I think, was missing in the previous days.
And sometimes you need that right person to ignite that spark in you, and that's all.
So in 6 months, he did it, and he actually passed. So when he called, I started crying.
Yeah. That feeling is amazing.
Because I was like, oh my God, to be honest, forget about the money, forget about everything. It's just incredible. One small difference you can make. And like these days, when we get so many messages on YouTube videos, as someone says, oh, I've passed my exam, I did not even do your course, but I just connected with that one YouTube video. And I feel like that just is everything.
And after a certain point, like, money goes secondary. And this, the satisfaction of, you've touched someone, you've helped someone. That's the biggest achievement, I feel. Like, that's one of the main reasons I started like helping and mentoring people. Like, be who you needed when you were young is also something I believe. So if I didn't have a lot of mentors while I was doing my ADC journey, so I'm like, if I can help at least someone in their journey, that's there. Like, I'm already fulfilled and satisfied, if I'm able to reach one person, make them pass and help in whatever ways I can. But that's a lot of credit goes to you, Dr. Mac, as well. Like, you started off when I saw you, I saw your videos and everything, and I also knew after like talking to you, you also come from like, you did masters in public health, you did all the jobs like similar track, so it's like I knew, okay, it's not unattained. Like you said, if you did it with all the struggles that you had, I was like, I can do it too.
Yeah.
And then all of your videos and then the courses and everything.
But was it like initially when you heard of online, because you know how a lot of people are skeptical about online or on-site, how did you, what was your mind?
So I was a bit,
now a lot of people do it, but previously especially, what was running in your mind at that?
So back then it was like skeptical. Like, okay, how am I going to learn online if there's nobody to teach me? How am I going to learn it? But then once I enrolled, you do a lot of feedback sessions. There's a WhatsApp group, and I came up on call with you, personal message and all of that. So do a prep, take a photo, be on a call with you. You send long audio messages. So all of that helps. But initially, the on-site courses that were there, they charge crazy money for on-site for a week or for maybe 2 weeks max. Your course was less money. It's still less money because I'm aware of all of this. It's still less than what all the on-site courses are. Less money, and you give 6-month access. There's 3-month access. So I can keep going back and back like 20 times, and that's what I did. Like, I do a crown prep, I'm like, oh no, but according to rubric, it's not right. So what did I do wrong? Go back. If I did an on-site course, it's gone. Once I get a demo, that's it. Forever, it's gone. And money is tight, right? For every candidate. So you spend that $10,000 for one demo. And I'm like, I'm getting 6 months worth of demos and feedback and everything. So that was the biggest difference for me. I was like, okay, online will make sense because of this.
Yeah.
So
I think that's what the biggest feedback now in say about, we started in 22 March.
Right.
And since there, we have candidates who have like from Qatar, from Saudi Arabia, from Colombia, from India, Pakistan, Nepal. Some of them never came to Australia. They just came for part 1. They just came for part 2, and they just passed the exam.
Yeah.
And sometimes I feel like with online, if you are actually giving all the sessions and reviewing it, rest is again, it's everyone has their opinions on it, and nothing is right or wrong. I always say this, but it could still help. And it could work out for you. But I always genuinely believe at the end of the day, either you do on-site or online, no matter how good the content is, no matter how much it helps you, it's also on the candidate. If you are not willing to,
And nobody can help you.
I can give you 4 on-site courses. I can pay you like all the money for it. You will still not.
And a lot of time candidates make that mistake. Sometimes candidates feel that, oh, if I do this course and that course, I'm going to pass it. But the exam, it's not in the course. At the end of the day, you yourself have to pick the handpieces, do the work and do it.
So Ahan, I'll tell you, like, there's so many people I've met or I've talked to who they message me on Instagram or YouTube or Facebook, and they're like, I've done 3 courses, but I still managed to fail. I didn't manage to pass. It's about this instructor, that instructor. That is exactly what we are saying. Sometimes you just have to get your ego down, try to analyze what someone's trying to explain you, and what could you do to actually help out. And sometimes it's good to sit down and say, maybe this is my mistake.
Just a learning mindset in general. Like, nobody's bigger, nobody's smaller in that sense.
And we all are dentists at the end of the day. We all are dentists in our country. It's not like we're dental students.
Correct.
Everyone is a dentist. So sometimes I feel like if you sit down and say, if another dentist is giving a suggestion, especially if you're going to someone who you genuinely trust and you feel like they're going to help you, then sometimes it's good to listen.
So good.
To that mentor as well.
And cultivating that habit is so good that now, even after ADC, I have had complex cases. I'll go to my colleague in the next operatory when in our breakdown. I'll say, hey, see, these are the photos, these are the X-rays. What shall I do? Or I'll do a root canal. If it's complete, I'll show the X-rays to my colleague. What do you think is wrong? Or how can I improve? So that mindset while we're prepping for the ADC also helps in the career as well. Because you get to learn from your colleagues like that.
Absolutely. And again, coming back to positive mindset, it's very important. We were talking about the environment matters a lot as well. But at the same time, sometimes if you have done all the courses and you still, for whatever reason, didn't manage to pass, just sit down and say that it's not about you could do 200 courses. It's courses help you, they guide you, a good mentor helps. But at the same time, you have to analyze your mistakes, reassess and say that, okay, this is something am I doing? What are my mistakes? You have to point out and work on it.
You have to, like you said, put your ego down, and actually just the first step is like agree to it that there's something wrong in whatever the procedure that you're doing. And then by that point you have a clean slate, and then you just learn from that point on, I guess. That's important.
And like Ahan, as we know that this journey could be very disturbing. We get really anxious, a lot of stressful moments where we feel like maybe this is not going to happen. And that's why we talk about ADC, and I tell people that if you've passed ADC, you could do anything.
100%. That's what I tell everybody.
So there are moments where I hear so much from people, it's so like heart touching sometimes. It's so much like saddening as well that people, they go through divorce, they go through they leave their kids, they've lost their family members during that journey where they were so busy in their, making their life and everything. And sometimes it's very difficult. So I wanted to ask you as well, did you feel at that one point where you felt like you almost gave up and you felt like, oh my God?
No, definitely, yes. Like I can instantly pinpoint to that one moment. And I'm sure every ADC candidate has had that moment where it's the darkest, But like I've read, and everybody must have read, like it's the darkest before the dawn. So in that moment, it was like I had just failed. I got my result for my part 2 exams. I had failed the exam. And I was at work, saw the result while I was working. I was like, what's happening? Like, I failed. And up till then, like as a dental students in the past, we never failed. Our education system is such that we are meant to pass the exams that we take in our college and stuff like that. That was our first dealing failure, So that was there. And then I went on my lunch break, called my parents up, and that was the first time ever in 3 years after moving to Australia that I cried in front of my parents and I almost gave up. I was like, what am I doing? Like, is all of this gonna worth it? You have spent so much time, money, effort to send me here, I'm doing all of this job, studying, all of this effort, but still yet I fail. Like, what now? So that moment was when I was like, am I doing it? Is it a right path? Should I be even pursuing this, or should I change to, like, a lot of people have like plan B, go to a different course or stuff like that. So that moment was there.
And I think that's the thing with ADC. I was talking to people who are doing national boards and Canadian exams and then UK exams, because there's so many options these days. You can go to US and you can do part 1 and NDB exam. Now they have a joined together part 1 and part 2 of the written exam, and then you can get into DDS, INDB. Integrated now they have that, because previously they had the part 1, which was more first year, second year. Then it was part 2, which was second year, third year. Now they have, I think,
all combined.
And I was telling them that, thing with ADC, which I find really difficult, is you're on your own. If I would love it, like when people do pharmacy, they do the exams, or people do Australian Medical Council, they do the exams, but they do the residency for 1 year in the pharmacy in Australia as well, in the medical council, like in the hospital. Same with national boards or other areas. You notice people do 2 years of DDS. Yes, it's money, I understand, but at the same time, you go through a journey with your other 50 colleagues or 100 colleagues. With ADC, I feel like, yes, some people get lucky, or maybe you have 1 or 2 partners, but at the same time, most of the time you're at home.
It's a lonely journey.
You're alone, you're prepping, and then the pass rate is so low, you don't know if you're gonna pass. Like, when we did BDS, we both did BDS, maybe, I think I had 59 people in my class. How many people, you remember?
90 something.
How many people passed BDS?
Maybe 1 or 2 failed out of 100. That's it. That's it. And they failed like a subject, not they finished the course
and then,
with me.
And then
subject.
They did maybe a supplementary, and then they passed
that's
it.
They cleared it in 6 months, so I didn't have to miss a year. Nothing was like.
That's what I feel as well. Out of 59, everyone passed.
Exactly.
2 of the people, they repeated 1 year, the worst case scenario, but then they passed. Some were in my class who were like, they failed, so they had to repeat the year, and we went forward. Most of them passed.
Right.
With ADC, the pass rate is sometimes below even 15, 11%, less than 11. So that means all those dentists, and that's why I feel like it's saddening, because they're all dentists. Pass rate is so low, less support. It's a lonely journey, and that mental trauma you get, it's because you don't see the light at the end of the tunnel.
Exactly.
You're just walking in the dark.
Correct.
And you feel like, yes, you could be positive.
Yes.
But at the end of the day, we're human beings.
There are days where the self-doubt creeps in so much that I remember, like, it was debilitating. I was like, I did not want to get out of my bed and do anything, because I was like, why even do it if I put so much effort and I still am gonna fail? And why do it? But then you have to find whatever that is, your own intrinsic motivation.
Absolutely. And that's why I tell everyone is, it's not about demotivating people, say no, but it's just the realistic points there that, it's like less support. When we were doing, they were always friends, and you have night stays, and you're on the uni, everyone's practicing together. Like when we are working, so many other dentists, someone's case go down, or someone's root canal is not working, or your aesthetic case, and you help each other.
It's a shared journey.
So if we even have friends, if we meet 1 or 2 people, it's great to have. Do you feel like it's great to have study partners?
Very important, not just as a like a help for like mental health, but for actual ADC preparation, it is very important to have a good study partner, and also like not just a study partner who you feel is a competition. You have to grow together. That is also another thing that we have to remember, but very important to have a study partner.
And that's what I've noticed is, because you're not getting any university help, and going to the university, you just create that yourself. I had a group of 5 people.
Yes.
And out of 5, 2 would be busy, but 3 would be there.
Exactly.
Have regular chats. And one thing, and you will notice this, Ahan, as well, unfortunately, there's always that competition that creeps in. People feel if he passes, he's going to take my place.
Right.
So there's always those things as well, which I feel like no one can take your position. So you don't have to step down on someone. So many people, like I have over 250 plus videos on my YouTube. You teach so many people. I've seen so many of your videos.
Yeah.
How many times I talk about any other instructor? You will never. Because I feel like you don't have to put anyone down. Just focus on yourself. Have you noticed with ADC, it's getting a lot there that people feel?
A lot. Like, as in, they feel like
competition and they feel like,
yes,
if he passes, he's going to take my position.
Like just recently, last week, I was talking to one of my friends.
Yeah.
She had a study partner for a long time, but that's what she had called me regarding that. When she took her part 2 exams, she did everything, and then when my friend called her to get a feedback, she's like, oh no, I'm very busy now, you do your own exams, I can't help you now, I can't help you. And she was so like, she felt so low, like this person, they were in the journey together, and now that she has taken the exam before my friend, but she's not willing to tell how the exam is, what's the pressure like. And then it's just that, like, the reason was she was just too intimidated that if I tell her, she might get an edge and she might pass. So that is very sad.
And you'll notice there's some people who are like, your friends, when you pass and they do. Because I had, out of 5 friends, I passed.
Yeah.
All of the 4 didn't.
Right.
And they started the part 2 before me. And I could see their support was still there.
Yeah.
That you deserved it.
Yes.
But then I was there for them, that no, I have to help them. But at no point we each other felt that, oh, he's going to take my position. We were literally helping.
That is so true.
I feel like that's where we were talking about the environment.
Yeah.
When you pick a partner or a group partner, also make sure they are there as a positive.
Yes.
Because if they have that mindset and later they feel like, oh, he's going to take my place, that's why when you pick your environment, that positivity is so important.
Right. And in that sense, like, for example, like, if people are watching your videos, they know you as a person. Another reason I joined and my study partner joined your course as well was like, okay, I can tell what kind of a person you are. So what kind of candidates you would attract, right? Similar mindset candidates. So we're like, and then when we get into your WhatsApp group, we are all like-minded people. So that is another place that you might not have a study partner before you enroll into any course, right? But if you enter a course and then there's a WhatsApp group there, you might find someone there. So always be on that lookout.
And I feel like that's why sometimes I used to post like motivational voice talks, 2 minutes, sometimes a video message. If someone's doing a crown prep, I think there was one of my students, she said, oh, can you not tell us if it's a fail and a pass? And I was like, with my way of teaching, if you see psychologically, when I post, if someone posts photos and that's the format we do, I post a video review saying this, I generally pinpoint the good bits, the bad bits where they could improve.
Absolutely.
That's it. And because majority of the time, I feel like we are on an initial basis. If I tell everyone fail, your mind's just going to register fail.
Absolutely.
And psychologically now it's proven, if I say you're doing good, you're actually translating that, your whole body.
True.
Like, Bruce Lee used to say, never talk negative about yourself even as a joke. Because your body,
the subconscious mind reacts to all of those stuff.
Absolutely. You don't know what we are kind of like, perceiving, and your body is how it's taking. Because you might feel it's a joke, but that actually, so that's where the concept comes, even when we're doing video reviews of motivational, you notice some people say, oh, it's very motivational. It's for a reason.
Absolutely.
You want that. Because after a while, it's not about if you could do an amazing crown prep. As we always talk about, fit in the criteria and do your best job possible. That's all.
That's it. And that is all that is required for the exams. Nothing fancy like you always say in your videos and stuff.
Now, let's go to the good bits as well, right?
Sure.
I know it's a stressful journey and it is there, and positivity is a great part of it.
True.
Anything in life, not just ADC, I think with the positive mindset, you can get over it. Once you pass ADC, you know how people think ADC is done and then they realize now they have to work as a dentist. Now it's even more stressful.
True.
So the journey will never end.
Never end. The stress is going to be there. It's part of life.
Part of life.
Yeah.
Tell me How was your feeling when you
Yeah.
passed? Do you remember that moment?
Absolutely.
Do you remember the day as
It was
well?
amazing. It was about, I think, 11th of November 2022.
Yeah.
I want to say. This is 24, 22, yes. So about 11th of November.
Yeah.
Again, I was working this time again. Saw the result and I saw passed. So I just put my phone inside. I was like, what? Really? Is this a pass result? I was like, let me look back again in a minute. And then I went to my room, took out my phone and saw, I read the whole thing, satisfactory, like just saw it and like goosebumps even right now, like all those 6 modules, satisfactory, all of that, and then overall result passed, and then just started crying right there and then and there, and I then, because while I was crying, I took my phone out, recorded a video, and just said to myself, like,
While you were crying?
While I was crying, I have that video. Nobody has seen it except my wife. It just says that whatever you set your sights on, you can achieve it. And just as a reminder, just as a symbol thing, like, like if ever whatever life brings on in future, I'll look at this video. Like, I've been through a lot. This is a testament that, okay, I can achieve it. So made that video. Then I had promised my little sister, she's 8 years younger than me, she's in India, that I'll buy whatever the latest iPhone is available in the market whenever I pass the exam. Yeah. So went straight to JV Hi-Fi, bought the iPhone 14.
So you didn't tell your parents or sister?
No, nobody knew. So I went and bought the iPhone, and then I had made my mind that I'll not go to India before I pass the exams. Okay. So this was 11th of November. I booked my flight for 19th of November.
Amazing. 22.
Yes, 2022.
Yeah.
Flew, and so for 8 days I didn't tell anybody. Yeah. Anybody. It was hard. I might have gained the weight just because of holding it, but I didn't tell anyone. Yeah. Landed. Even the India visit was a surprise. So landed, spent time with family, and then we're just sitting after lunch. My mom, dad, sister, and my grandparents. I gave a letter to my.
You have seen that video.
Yes, there's a video on Facebook.
Right? Yeah.
Yes. So I gave a letter to my parents first. It was a poem saying, thanking them. I had read it somewhere. I just wanted to give that to them, thanking them for all they've done and all of that. Very emotional poem. My mom already started crying by at the end of that letter. And then I gave another piece of paper. I said, this is another letter I've wrote. And when they opened that one, that was the ADC certificate. And that video is on Facebook where my mom just jumps and just says, oh, you passed the exam. My dad is jumping, and then my grandparents are laughing. So that moment, that's the, like, if anybody watching ever has, if you haven't taken the exam, or if you've taken the exam and failed, like, that moment, that not for yourself, but for people around you who have not just supported you, but like given their effort into your,
in there in your hard times.
Yes, in your hardest times, for them. Use that as an intrinsic motivation to kind of,
And
go forward.
I always ask this question from everyone, because this moment is so precious.
Very pure.
You can pay $1 million, you can't buy that.
Yeah, for sure.
You know what I mean?
Yes.
And I always tell everyone, you work so hard that when you achieve it, you cry.
Yes. There's something about it. It's just tears coming out. I don't know what it is, but it's
I remember talking to my friend recently. He's doing a fellowship in Pakistan. It's FCPH is one of the most toughest.
Okay.
So it takes you 5-7 years, and then you have to do the part 2 practical, which is very difficult. And then he didn't pass the first time, the second time, third time he passed. He was actually crying. And I told him that, after a while, that hard work is so real, you cry. So I've seen people, when they don't cry, I'll be like, maybe you didn't work hard.
True. Back in the mind, you probably know that you didn't work hard enough.
I'm just kidding. I'm just kidding. But
True,
no,
all
those tears are so special.
Yes.
And I can 200% relate with you. As you said, you recorded yourself.
Yes.
That moment is so precious that after that, any difficult thing comes in life, you'll be like, I've done ADC.
Exactly.
I can break a wall with my hands if I want to. It's so like,
because
powerful.
It changes you as a person, not just as a dentist, but as a person. You can withstand so much outside forces and still not falter and still go on. That's what ADC teaches.
And another thing I definitely will say is, don't forget the people who were there for you when you were struggling.
True.
That may be your parents, your loved ones, your friends.
Absolutely.
Because I feel like those relationships, your friendships are very important. Because when you were nothing or you were struggling, when people who helped you, they're the most genuine people.
100%.
After you've passed ADC and you have like the status and Instagram and social media, everyone want to be friends with you, or everyone want to be there to support you.
Absolutely.
But you don't need the support at that time. You know,
Yes.
you need
Yes.
it, but do not, like you said about, you know, there's simple things as thanking someone,
That's it.
thanking your parents. Like, I feel like we miss out so much on thanking people.
People, yes, exactly. Like
Appreciating
just
them.
gratitude towards people, towards everyone around us, because we sometimes overlook what people are doing around us. We're just in our own battles that we forget, but just
Yeah.
smiling or just saying thank you to anybody and everybody around us changes the entire moment.
And I think some of the things that still motivate me when I hear from people is when people who do the exams, when I was doing it,
Mhm.
when they reach out and say that, can you help us?
Yeah,
And I always look back to the moment that
Yep.
I could have been on their place.
absolutely.
So, and how would I feel? Because it's very difficult to go and seek for help,
Yes.
you know? And if you don't get a positive response, that person, one of my professors actually,
Oh,
he used to teach me, I don't want to name the subject or anything, but he used to teach me when I was in my dental school. He was doing ADC.
oh wow.
And he reached out to me after 3 years, and someone told him that, why don't you reach out to him? He's your student. He's like, you know, when he reached out to me, he talked to me. The first thing I was like, you know, then I had to call him just to say,
Yeah.
and he's like, and I was like, why didn't you reach out to me? I didn't have any idea you're doing ADC.
Right.
And he's like, I reached out to 2 of my previous students,
Oh,
but their reply was so
cold reply and stuff like that. Yeah.
and I could see that there's so much attitude and arrogance in their voice, and I felt so bad. And I felt like so strongly, and I'd be like, you know, it is actually that.
Yes.
When I feel like it's a lot when you pass ADC or anything in life, it shows a lot more of your character as well.
Absolutely.
And once you get everything, how you're behaving.
True. Like, to add on to that, when I passed the exams in November 2022, went to India, came back after 2-3 months spending time with family. Even after coming back for 4 months, I did not work as a dentist. I still worked in the same aged care facility that I was working before becoming a dentist, just to prove myself that, just as a reminder that, okay, I've become an Australian registered dentist, but no ego, because I'm still gonna clean people's rooms, gonna clean people's toilets, gonna cook for them at the aged care facility I was working. I did that for 4 more months before looking for a dentist, like a job as a dentist, and then starting as a dentist. Like, a reason was just that, to tell to myself, like, okay, this dentist is not gonna define me as a person. You have to be humble. Like, we're at the end of the day, like, ego aside, right? So I still did that job for another 4 months after coming back from India, just for that sake. Like, okay, like being a dentist does not prove my worth in the society. I'm still a normal human being who is going to be working as a dentist, who was working as something else. Now I'm working as a dentist.
That's why, you know, highly recommend people, if you work as a dental assistant, go door to door, what is a wait person?
Absolutely.
Do some odd job, because sometimes they feel like, oh, why do I want to work, you know? But it's gonna make you better. Tomorrow when you'll be a dentist, the way you treat your dental nurse and your receptionist and the cleaners, it makes a man. Because once you've done it, you feel that, you know?
Feel empathize, you feel the empathy for the other people who are working around with you. And in a dental practice, you know how important it is to work, you know? If you're not respecting the receptionist or the dental assistant, you can't work as a dentist without their support. Our job is, of course, important, but they do a lot of the back end work. So it just is very good to be good to people, because everybody, we all grow together, you know? Like,
absolutely. And the last thing, which is actually the most important thing, what is your biggest tip for people who may be struggling right now, who may be thinking, oh my God, I want to go to Australia, is it achievable?
Right.
Before I even ask you that question, I tell everyone, if I can pass, anybody can.
That's what I was going to say.
It's normal. You know, we're not like aliens or anything.
Exactly.
We also worked hard, we've passed it. But what's your biggest tip in terms of someone to keep their motivation high, or what helped you in that journey to keep motivated, and what's the biggest tips and tricks that you can guide people?
One biggest tip would be, of course, try to surround yourself with the right kind of people. Eradicate all the people who are going to pull you down. There's going to be so many people. I had so many people in my college back in India was like, oh, but the passing rate is so low, you're not going to pass. Then even after coming here, my colleagues, oh, the passing rate is so low. Oh, but it's so expensive. Oh, what? So what? eradicate those kind of people, you will find the positive mindset people with you who are going to motivate you, and then you can work together to achieve the goal. So biggest tip is surround yourself with people who are like-minded, but also eradicate people who are not like-minded, because they are the ones who can put the self-doubt in your mind as well. So that is the biggest tip about how to build relationships while you are in the ADC journey.
100%. And I just to add on your point, Ahan, I can't agree more. Also very important that if someone couldn't do ADC for whatever reason, doesn't mean you can't as well.
Yes.
I always tell one person that maybe if I couldn't pull that one tooth out, just to give you a rough example, doesn't mean you can't as well. Maybe you can, I couldn't.
Absolutely.
And there is a case. So if people tell you because I did it for 5 years and I couldn't do it, you won't be as well, I feel like it's a wrong
statement for sure. So those kind of people you do not want to be in touch with, because so many times like the people will text me and tell me, oh, but so many people are saying that you can't pass the exams, then should I even come and take it? My only question to them is, have you ever talked to anyone who has passed the exam? They're like, no, not yet. I'm like, talk to those people, talk to people who have passed it. They will tell you that it is achievable, like us, like we're not superhumans, like you said. We did all the
Ahan, people when I was doing it, they told me first it's impossible to pass. They didn't say they said it's impossible to pass. I know people have been doing it for 7 years, 10 years, and it could be true. Some of them were true. But and at the same time, they said even if you pass, they've removed a dentist from the skilled occupation list in 2015. You won't get the PR. And I was like, how about we think about that later?
Correct.
How about I just focus on my step on passing ADC, and once I pass, I can guarantee just with the mindset, there's something will be there. And it happened.
Same for me. Everybody, even after I passed the exams, and there's those kind of people who's like, but now what about PR? I'm like, that will also figure itself out. Like everything in life,
absolutely,
it will also figure itself out. So just keep going at it, I guess, and surround yourself with the right people.
And the last thing I want to add is, for ADC, it's not about how experienced you are.
True.
And Ahan can tell you that as well. I can tell you that as well. We are surrounded these days, especially with people who may be a specialist in their country. They have 25 years of experience, and we feel like, oh, I have 1 year of experience. Does not matter.
I was a fresher. I've never worked ever in my life. My first day of ever working as a dentist was in Australia. I never worked in India.
And sometimes we feel like we could get really overwhelmed. Or under pressure, that if someone is sitting with me who has 20 years of experience, I have no experience, and I tell everyone, it's not a specialist exam. It's a general dentist exam that Australian graduate who graduates, basically they're judging at the same level. So if you don't know, it's okay.
Absolutely. You don't have to feel intimidated by the next person who's a specialist
100%.
or whatever in their own country, 100%. So that is important.
So Han, I really appreciate you sharing your knowledge and your experience, because I feel like it will help so many people just listening to you, and you're so inspiring. Like I'm getting inspired just talking to you as well, getting my motivation
Likewise, Dr. Mak.
So thank you for sharing your your knowledge and you're sharing your experience. And I'm sure most of the people who listen to your conversation, they'll be like, okay, even if I was thinking about dropping ADC, now the plan
is... If you were about to drop it, this is the spark that you needed, this conversation. Just use it, ignite a big stick of matches, and then, start your ADC journey. Burn that flame in you. That's what I would say. But thank you so much, Dr. Mak, for having me. It's really lovely talking to you.
Amazing.
Thank you.
1,000 miles, feeling so tired, but I can't stop now. Came way too far, won't throw in the towel. It ain't looking real good, but I won't give up. Pac said that I gotta keep my head up, so I ain't going nowhere. Yeah, I'm standing right here. Demons all around, but I ain't got no fear. You can kick me around, but I won't stay down. I run this town, ain't backing down. We going the rounds. Yeah, the winds will blow, but these roots too deep. I'm on my feet, the underdog, and I won't be beat. In the fire now, but I won't be burned. I was waiting for this, and now it's my turn. Sweat on my face, blood in my eyes. Been underground, now I aim for the sky. Don't quit now, you can last longer. All these wounds only making you stronger. Don't give up now, yeah, you gotta climb.